Just a reminder, we will be recording this webinar today.
All right, good afternoon, everyone, and welcome to the Subrecipient Monitoring Technical Assistance webinar for Tarrant County HIV Administrative Agency. We appreciate everybody joining us today on this webinar. Next slide. Just a brief introduction. We'll start out with some remarks from the recipient's office. Caitlin, I'll turn it over to you if you have any announcements or any brief remarks.
Hi, everyone. Can you hear me, Thomas?
Yes, ma'am. We got you.
All right, awesome. Hi, everyone. Caitlin Lopez with the Administrative Agency, Quality and Planning. I think everyone knows my email. Feel free to let me know and I'll send it.
Great. Thank you, Caitlin. So next, what we would like to ask is for the subrecipient and staff, if you could, in the chat, please provide the following information: your first and last name, the organization you represent, your title, and your email address if you'd like to max that up for the registration. And next, we'll start out, we'll circle back to Caitlin. And Caitlin, let's circle back one time. Caitlin, if you'd like to introduce the remainder of your staff, it's a pretty big group, so it's hard for me to catch everybody that came in really quickly. But if you'd like to introduce the rest of your staff that you have online today.
Sure. Lisa, do you want to start off?
Hi, good afternoon. It's Lisa Mutai. I'm the HIV Grants Manager for Tarrant County, and I just want to thank everyone for being here today, and thanks to Collaborative.
Thank you, Lisa. My apologies, Lisa. I did not see you come in. The list,
Okay.
everybody's name on the list started moving. All right.
It is all right. I'm going to go to Barbara.
Thank you.
Hi, everyone. My name is Barbara Kakembo. I am the financial coordinator.
Thank you, Barbara. See Caitlin Malik.
Good afternoon, everyone. My name is Caitlin Malik. I'm the Assistant Quality and Planning Coordinator here at the AA.
Renee, and then Dulce.
Hi, Renee Thomas, Grants and Data Coordinator with the Administrative Agency.
Dulce.
Good afternoon, everyone. My name is Dulce, and I am the Assistant Financial Analyst here at the AA.
And if I missed anyone, please let me know.
I'm here, Lisa.
Oh, sorry, Lynetta.
No worries, I stuck in. Lynetta, HIV Initiatives Program Manager. I work under all things EHE. Good to see you all.
And I believe that is everyone. Thank you.
Great. Thank you so much. All right, so really briefly, we'll introduce the collaborative research team. Starting out with Derek Jackson. He'll be our project manager for this particular project. Nathan was not able to join us today. He is out of the office. We have myself, Thomas Ruggie-Beshecker, and we have Kendall Brooks, who's with us today. Kendall? All right. So just a quick overview of what the purpose of the webinar is. This meeting aims to introduce the subrecipient quality assurance monitoring process, and it's going to cross the 23 and 24 grant years as mandated by the Tarrant County HIV Administrative Agency. The meeting aims to provide background information on the monitoring process. We'll also have an opportunity towards the end to discuss any potential challenges or things you may see arise later on, and will help develop an action plan for implementing the process to be successful. Excuse me. Additionally, the meeting allows for an opportunity for everybody to ask questions, clarify any concerns, and contribute to the development of the action plan. So we want to make sure everybody has an opportunity to ask questions. And again, today's not the only day that you can ask questions. You are certainly able to email us at a later time if something comes up after this all this has sunk in for a little bit. Next slide.
So the
So
monitoring process.
oh, go ahead.
I'm sorry. The monitoring process is going to be looking at the time frame of the calendar year 2024. So January 1st, 2024 through December 31st, 2024. It's stretching across 2 grant years. And it will be conducted in 3 phases. Fiscal monitoring, which will be FTP uploads, along with universal monitoring, also FTP uploads, and the service category chart monitoring, which will consist of on-site and virtual visits. The fiscal monitoring will utilize the HRSA-HAB fiscal monitoring standards. Documents demonstrating compliance to the monitoring standards will be uploaded to the FTP site. When necessary, this will include interviews with the subrecipient fiscal staff to review compliance. An upload should be completed by January 17th, 2025. Very similar to the universal monitoring, it will utilize the HRSA-HAB universal monitoring standards. Documents demonstrating compliance to the monitoring standards will be uploaded to the FTP site. Again, when necessary, this will include interviews with the subrecipient's program staff to review compliance, and uploads should be completed by January 17th, 2025. For our service category monitoring, we will utilize the Tarrant County Ryan White Service Standards, EHC contractual agreements and deliverables, as well as HRSA-HAB programmatic monitoring standards.
The HRSA-HAB National Monitoring Standards. We'll talk a little bit more about this and what they are. So the National Monitoring Standards is a consolidated requirement that HRSA and HAB have put together. It helps establish what the legislative, regulatory, and programmatic requirements are for the Ryan White program. The National Monitoring Standards are divided into 3 different sections, which is program monitoring, fiscal monitoring, and universal monitoring. While there are separate national monitoring standards for both Ryan White Part A and Part B, the universal components address the general requirements of all of the Ryan White parts. So we will still hit upon the legislative, regulatory, and programmatic requirements for both fiscal, universal, and the programmatic. We do highly suggest that you take a look at those national monitoring standards, but we'll get to that slide in a second so you can get a screenshot of that. Next slide. So here we are. If you would like to scan that QR code, that will take you directly to the national monitoring standards. So we'll give it a couple seconds if anybody wants to do that. We'll also provide that link in the chat. Right. Next slide. Oh, somebody says they're getting an oops. Uh-oh. I'll definitely drop the link in the chat.
Diving more into fiscal monitoring. So again, the fiscal monitoring, the review timeframe, reimbursement requests will be reviewed for compliance to the uniform administrative requirements and cost principles. We'll be asking for one of the reimbursement requests during the calendar year that we are reviewing. Subrecipients are asked to complete the fiscal monitoring tool and upload the tools and supporting documentation to the respective folder. Upload documents to the FTP site. So subrecipients are required to upload compliance documents to the Collaborative Research FTP site for review. And as mentioned earlier, one-on-one Zoom interviews will be necessary if we have any additional questions or concerns with the documentation that we were reviewing. So for the fiscal monitoring requirements, these are all of the requirements that we'll be looking for, the sections. So we have limitations of use, unallowable costs, program income, imposition and assessment of client charges, financial management, property standards, cost principles, auditing requirements, and fiscal procedures. Again, documents used for compliance in each of the above sections should be uploaded to the FTP site for review.
And Derek, I think it's worth mentioning here that this aligns directly with those national monitoring standards. So if you're wondering where those sections come from, when you start reading the national monitoring standards, you will see these exact titles and subjects.
So as Thomas was mentioning earlier, this is a sample excerpt from the national monitoring standards for the fiscal section. This is what it will look like in those national monitoring standards, and this is where we get those sections from.
So here, I think it's worth mentioning when we're looking at specific sections related to what the sub-recipient responsibilities are, as you're reading the national monitoring standards, and this is a great example. For instance, under limitations of use and for A1, it says for recipients without a fiduciary, intermediary, or administrative agency. You'll notice that under A13, sub-recipient responsibilities, it says not applicable at the sub-recipient level. So when you're reading through the tools, you'll notice that this is not one of the requirements we need to answer for the national, for the monitoring sections on fiscal.
And here's a snapshot of what that fiscal monitoring
Yeah,
would look like.
can I interrupt for just a second? Thomas, you're cutting in and out, and I noticed someone put in the chat they're having trouble with audio, but you are cutting in and out.
Okay, thank you. Sorry about that.
That's much better.
Okay.
This is a snapshot of what the fiscal monitoring tool will look like. The sections that you'll be answering are to your left side. So here we have questions under subcontractor services and time and effort, just to kind of give you a glimpse of what that tool looks like. It is an Excel file. Again, it will be provided to you all. We ask that these are completed and uploaded into the FTP site.
All right, universal monitoring. So to complete the universal monitoring tool, we'll ask that subrecipients complete that tool and upload the finalized tool to the FTP site. We will also ask you to upload documentation for compliance. There's particular questions, very similar to the fiscal monitoring. And as necessary, we will come back and schedule a one-on-one interview with subrecipients should we have any questions or need additional clarification about documentation for a particular question of performance measure. So again, as in accordance with national monitoring standards, the universal requirements include sections like access to care, eligibility determination, payer of last resort, anti-kickback statute, recipient accountability, reporting, and monitoring. Again, the ask is for subrecipients to upload documentation for compliance in alignment with each of these sections to the FTP site for review. Next slide. So here's an excerpt from the National Monitoring Standards. And this is a great example because here we do have some subrecipient responsibilities. This particular section is under access to care, and more specifically about structured and ongoing efforts to obtain input from people with HIV and the design and delivery of services. So the subrecipient's responsibility here is to maintain a file of materials documenting consumers committee membership and or attendance and meeting minutes. Or you can regularly implement a client satisfaction survey, focus group, or public meetings. But you would also need to supply us with analysis of the results from that particular meeting, focus group, or survey tool. Or finally, implement appropriate mechanisms to obtain client input. So if you have another innovative way of implementing client input, you would have to upload those documentation for compliance to this particular question. Next slide. Here is an example of a sample monitoring tool. It should only be one tool, not two tools. So when we look here, particularly in the beginning of the questions of the universal, it also has some programmatic questions. So for instance, at the beginning, it will ask you if you're funded for a particular service category. If so, there may be some additional documentation that you have to provide in relation to that particular service you provide. So we'll look at number 3, for instance. Does your organization provide medical case management services? If so, you'll check the box or boxes for whichever funding stream you may be funded for. And then it will also say, yes, upload documentation of assurances and maintain documentation showing that medical case management services are provided by trained professionals. And so you will definitely have to upload something for that if you are funded for medical case management. And then also upload documentation of policies and procedures for maintaining client records to include specific elements as listed in the national monitoring standards. If you are not funded for that particular category, you would simply check the no box and continue on in the tools. Next slide. So a little bit later in the universal monitoring tool, we'll come across some additional compliances that are not related specifically to a service category. So for instance, number 7, does your organization have policies for the provision of services regardless of an individual's ability to pay for the service? And so these are not trick questions. A majority of these are a yes answer. So your organization should have a policy or procedure related to that particular monitoring standard. So next slide.
The FTP site access, sorry. Someone's, okay. Access to the FTP site. A link to the request access to the FTP site will be included in the email regarding site visit monitoring. Subrecipient personnel who are responsible for uploading and reviewing compliance documents pertinent to fiscal and universal monitoring will be required to request access to the FTP site. The FTP site is a web-based and HIPAA compliant. However, you should not upload any patient private health information, PHI, to it. Uploading compliance documents. Many questions in both the fiscal and universal monitoring tools will require subrecipient staff to upload compliance documents. The FTP site is set up to align directly with the monitoring tools. So for example, if you're planning to upload compliance documents to question 10 in the fiscal monitoring tool, you will simply drag and drop the compliance documents into the FTP site under the fiscal folder, question 10. If the question is not applicable to your organization, you will choose the no answer on the tool and move on to the next question. So it's very important that the completed fiscal and universal tool are uploaded into the FTP site. Once you have received your credentials to access the FTP site, you will be able to log in. As a reminder, do not share your login credentials. If you have additional staff who need access, they too should require access to the FTP site. This is kind of a snapshot of what that login landing page looks like. The file structure is divided into fiscal and universal folders. In each fiscal and universal folder are question number folders that correspond to a question on the monitoring tool. You will drag and drop or upload compliance documents that correspond to the question you are working on to the corresponding question number folder.
Service category monitoring. So this is specific to each of the service categories, or we also call this chart monitoring. The chart monitoring is another way that we look at the programmatics of each of the service categories and how that is being delivered for the Tarrant County HIV Administrative Agency. It also allows them to assess service delivery and the quality of treatment and care and support services being provided through each funding stream. This type of monitoring reviews client charts and makes sure to assess the provision of specific services. So sometimes each service category may require specific steps to be completed when providing the service. The Tarrant County AA provides a range of funded service categories through multiple funding sources and service categories. The service category chart monitoring ensures that organizations deliver services in accordance with program guidelines, service standards, and the national monitoring standards. Next slide. The goals of the chart monitoring include assessing the delivery and quality of services. The charts will be monitored to assess the delivery and quality of services. Also, identify areas for improvement. The chart monitoring helps to identify areas where organizations may need to improve service delivery. Ensuring compliance with programmatic requirement. The chart monitoring process will also help ensure that organizations use program funds in accordance with FERSA regulations and to comply with program guidelines. Next slide. Service monitoring typically involves a review of client chart to assess the provision across the multiple funding sources. The AA may also provide technical assistance and training when organizations need to improve in specific areas. Overall, service category chart monitoring is an essential component of the program's quality assurance efforts. It's also aimed to ensure that program funds are being utilized in accordance with HIV treatment, support, and regulations. Next, guys. So service category chart review. So we'll review the TGA's standards in accordance with Policy Clarification Notice 1602 and in accordance with the National Monitoring Standards. Again, subrecipients will be encouraged to review the TGA service standards, the monitoring tools, and the National Monitoring Standards to understand the requirements for demonstrating compliance with each of the performance measures for each of the funded service categories. Virtual and or on in-person monitoring. So it is kind of a combination of the two, and we'll look at that later when we get to the monitoring schedule. So monitoring will begin with an entrance interview and conclude with an exit interview. Leadership and programmatic staff should be present at both when possible. During the on-site monitoring, subrecipients should designate a knowledgeable staff member to be available as a point of contact for the monitoring team. Finally, chart pool and sampling methodology. The AA will create a sample size list for each of the funded sources by each funding stream of unduplicated client. This will be organized by agency and be provided in advance of the monitoring session. Next slide. The chart monitoring components include mini entrance interview and an exit interview. And so at the entrance interview, it will give collaborative research and the subrecipient team an opportunity to introduce themselves and have a brief discussion about strengths, challenges, and technical assistance for service delivery questions. Again, we will conduct a mini entrance interview for each of the subrecipients. At the end of our monitoring process, virtually and in person, we will conclude it with a very high-level exit interview. Excuse me. The interview will be scheduled as an exit interview to present outcomes of the monitoring visit. So on-site, we'll give a quick overview of what we saw and what the technical, some issues may be or some opportunities for improvement. And then later on, we will be able to give you a higher, more efficient look at what those outcomes would be with the monitoring reports. Next slide.
So the roles and responsibilities of stakeholders. The administrative agent will ensure compliance with federal regulations, managing all funding sources, implement quality improvement activities, collect data on program activities and outcomes, collaborate with stakeholders, subrecipients, and consumers of services to ensure high quality services are delivered to the community, and identify and provide technical assistance to subrecipients on the quality assurance outcomes. Our role, collaborative research, we will coordinate and facilitate the annual quality assurance process for the TGA, coordinate and facilitate technical assistance to the subrecipients on the annual quality assurance process, conduct monitoring for programmatic, fiscal, and universal requirements of the Ryan White HIV/AIDS program, provide comprehensive reports and outcomes of the quality assurance process, and identify and provide technical assistance to subrecipients on quality assurance outcomes. And for the subrecipients, you will actively participate in the quality assurance process, designate knowledgeable staff to the quality assurance process to successfully navigate client charts and agency policies and procedures, upload compliance documents to meet the universal and fiscal monitoring requirements, develop quality improvement activities related to the outcomes of the annual quality assurance process, and actively participate in all technical assistance provided by the recipient. Here's a snapshot of the monitoring schedule that's been determined by everyone's availability. These will be included in the monitoring notices, and they will be conducted during the month of January 2025.
Site visit reports. Final monitoring reports will be provided to the subrecipients 30 days from the last monitoring visit. Subrecipients who are required to submit a corrective action plan will need to do so within 20 days of the recipient of receipt of the final monitoring report. Monitoring outcomes will be divided into 3 categories: satisfactory, requires improvement, or finding corrective actions.
So next steps next steps for the site visits. Monitoring packets. So collaborative research along with the AA's office will distribute monitoring packets to each subrecipient by Friday, December 6th. Monitoring packets will include the official notice of intent to conduct the annual site visit, the site visit schedule, the CR team members who are assigned to conduct the on-site or virtual monitoring, and instructions for document uploads into the FTP site. Chart pool list. The AA's office will provide to each subrecipient a list of random charts to be monitored by service category. Subrecipients can expect the chart pool list at least 10 business days prior to their scheduled site visit. FTP site uploads. Subrecipients should complete the FTP site uploads of compliance documents no later than Friday, January 17th, 2025. And again, I stated earlier, one-on-one fiscal or universal monitoring interviews will be implemented as needed. We CR in concert with the AA's office will coordinate with the subrecipient a date and time to conduct a one-on-one interview for fiscal and universal monitoring.
All right, here's an opportunity. We'll probably stop sharing here. We'll bring it back up with contact information after this. But here's an opportunity for us to take a moment and ask questions or talk about any concerns that we may have. We will make the recording available. We will post it to our website so that we can provide a link for you. So if you have additional staff who would like to review this at a later time, or just need a refresher about what was said, we can always click on that link and go back and hear and see what happened. If you're like me, I can't remember what happened yesterday, so those links come in handy for me. All right, any questions, concerns? All right. Well, you're welcome. So if you did notice in the chat really quickly, I did share the link to the National Monitoring Standards. I would say that, yep, I will do it one more time just in case you missed it go by the first time. Things get buried in the chat, like what does in the participants list really quickly. So there's the link to the National Monitoring Standards. And Derek, if you bring up the slide with the contact information so that everybody has your information as well as Caitlin's information. So that if you have questions, please do not hesitate. We do ask that when you contact us to please include both Caitlin and Derek in the email so that the communication is in sync and everybody kind of are answering the same questions. And sorry. We ask you to email both Caitlin and Derek at the same time if you have questions so that everybody is in sync with communications. And Derek, I'll turn it back over to you, sir.
Thank you, Thomas. I think you covered it. So yes, we do ask that if you do email me, just please include Caitlin on that, so the AA's office is kept abreast of everything that's going on. If there's any contact or questions or concerns, please don't hesitate to reach out. And I will stop share so we can all see each other.
All right. Well, if there's no other questions, it was great seeing everybody. We hope you have a very safe and prosperous holiday season. And we will be seeing you very soon in January.
Hey, Thomas, I'd like to make just a couple comments if I can.
Yes, ma'am.
We get finished.
Of
So
course.
I want to encourage everyone to make sure that leadership is involved in the entrance conference and the exit conference. Also, the more prepared you are for the visit, the smoother it will go. I think that we just want to make sure that there aren't bumps in the road so that when the site visit starts, that staff fully understand what's going to be happening. And really, I can say from the perspective of someone that is monitored and the perspective of someone that it has been monitored, the more organized you are, the smoother this will go. We don't want for information to have to be searched through and searched through. We need to make sure when information is uploaded that it's clear what is being looked for. Because I'll just tell you from experience, the more you put out there that's irrelevant, the more that something may be looked at that wasn't intended to be looked at. So I just want to say, the more organized you are, the smoother it will go, and the easier it is for the monitors to find information. It's just in everybody's best interest for that. So I know everybody will be well prepared and very much appreciate this. And I will say, we don't intend for monitoring to be punitive. It's really a learning opportunity that we can figure out ways perhaps to do things better. Maybe there's some things you're doing that you don't necessarily have to be doing. And so, you know, I think we all have to just view this as a learning experience and an opportunity for improvement where needed. So appreciate your cooperation, and thank you, Thomas, for this today.
Absolutely. And as always, thank you, Lisa, for those comments and those words for preparement. Because you know, like Lisa said, this is never an aha, we got you type moment. This is a how can we help you be more efficient with what you're doing. We know you're doing great work. It's great work. So that's not the issue. We want to make sure you're doing it efficiently and as easy as possible. All right, Derek, anything else? Can do anything from you, sir?
No, sir.
All right. Well, again, we wish you a very happy holiday. And we look forward to meeting each of you in person. Some of you we've seen before, but I'm sure there's lots of new faces that we're excited to see. And we're absolutely excited to hear about the programming and innovation that you're doing. I always like to say we like to steal and share. We do give credit, but we love to hear innovation and share that with others so people can be successful. So again, thank you. Happy holidays, and we will see you soon.
Thank you, everyone.
Thanks.
Thank you.
Bye.